All right, let's get right into it. I want you to forget everything you think you know about clogged arteries, just for a moment. Because today, we're not treating this like a dry medical lecture. No, we're framing this as a high-stakes heist, a silent, slow-motion crime story that unfolds over decades, right inside your own body. And like any good crime story, we've got a prime suspect. This quote actually comes from our source material, and it's cholesterol itself speaking. It's found at the scene of every crime, it's implicated in all the major complications, but here it is, pleading total innocence. So, what's the real story? Is it really the criminal mastermind behind this whole arterial heist, or is it just a patsy, a fall guy, taking the blame for a much, much more complex operation? Well, that's exactly what we're here to figure out. Every great heist needs a point of entry, and for this story, the target is the pristine, smooth inner wall of your arteries. The infiltration doesn't happen with a bang. It's quiet, it's sneaky, and it all starts with a single tiny breach. So this heist has an official name, atherosclerosis. This is the technical term for the aftermath of the crime, this slow, steady buildup of junk that turns a flexible, open highway for your blood into a narrow, hard, and really dangerous bottleneck. And just like in the movies, this operation has its key players, a villain and a hero. Okay, so meet the crew. On the left, you've got LDL, low-density lipoprotein. We're going to call it the intruder. Its day job is to deliver cholesterol to cells, which is important, but it has this nasty habit of going rogue and slipping past the artery wall's defenses. And on the right, we have HDL, high-density lipoprotein. Let's call it the protector. Its mission is the exact opposite. It's the cleanup crew, hauling cholesterol away from the arteries and taking it back to the liver for disposal. And right there, that's our central conflict, the intruder versus the protector. So once the intruder, our LDL, gets inside the wall, the heist really escalates. But here's the twist. This isn't a simple smash and grab. No. This becomes an inside job, where the body's own security system is actually tricked into helping build the very blockade it's supposed to prevent. So how does this inside job even work? Well, it happens in 4 basic steps. First, the LDL infiltrates the artery wall. Then, once it's inside, it gets chemically damaged. It gets oxidized. You can think of it like metal rusting. This corrupted LDL sends out a big inflammatory alarm. So the body's immune cells, these guys called macrophages, rush to the scene to clean up the mess. But here's the kicker, the really wild part. They just mindlessly gobble up so much of this corrupted LDL that they get totally bloated, they get stuck, and they transform into these things called foam cells. The body's own first responders literally become the building blocks of the problem. And this gives us a fantastic look at what that final blockade, the plaque, is actually made of. At its heart, it's got this soft, fatty lipid core that's just full of cholesterol. Then it's covered by a fibrous cap, kind of like a weak wall made of muscle cells and collagen trying to contain the mess. And the whole thing is just simmering with inflammatory cells, which makes the entire structure super unstable. Now, our LDL intruder is crafty, but it doesn't act alone. A truly successful heist requires accomplices. These are the factors that weaken the bank's defenses, create distractions, and just make the whole crime much, much easier to pull off. And here they are, the usual suspects. On the left, you've got the stuff you just can't control, like your age and family history. But look at the right. These are the modifiable accomplices, the ones we can do something about. Think about it. High blood pressure physically damages the artery walls, basically kicking open doors for the LDL. Smoking and diabetes cause chemical damage and inflammation. It's like they're disabling the security alarms. And of course, having high levels of the LDL intruder and low levels of the HDL protector, well, that's just like having more robbers than guards at the bank. For years, even decades, this heist can go on completely silently. You don't feel a thing. But eventually, the situation becomes critical. This is the climax of our story, the moment when that unstable plaque finally ruptures and the heist goes catastrophically wrong for the body. So when a plaque inside one of the heart's own coronary arteries bursts, the body panics and tries to heal the injury by forming a blood clot. But if that clot is big enough to completely block the already narrowed artery, it chokes off blood flow. The result is a myocardial infarction, or what we all know as a heart attack. Now, imagine that exact same scenario. A ruptured plaque, a sudden blood clot, but this time it happens in an artery leading up to the brain. It cuts off oxygen and vital nutrients from reaching brain tissue. That is what causes a stroke, and it can lead to absolutely devastating damage. And the damage isn't just limited to the heart and the brain. When this kind of blockade happens in the arteries of your arms or legs, it's called peripheral artery disease. And in really severe cases, it can starve those tissues of blood completely, leading to tissue death, also known as gangrene. Okay, I know, that was the grim part of the story. But here's the good news. This heist is not unstoppable. Not even close. We have the intel. We've got the tools to fight back, to reinforce our defenses, and in some cases, even reverse some of the damage. So how do we actually do it? How do we foil the criminals and protect our arteries for the long haul? Well, it's basically a two-pronged attack. We fortify our own internal defenses, and we call in professional reinforcements when we need them. First up, our lifestyle defenses. This is how we strengthen the system from the inside out. Things like a healthy diet, getting regular exercise, and maintaining a healthy weight. They all work together to lower the number of those LDL intruders and boost our HDL protectors. And this is a big one. Quitting smoking takes one of the most dangerous accomplices right off the board, stopping that damage to your artery walls in its tracks. And look, when lifestyle changes aren't quite enough, we call in the medical reinforcements. Statins are incredible drugs that directly tell your liver to make less LDL, and they also help make existing plaques more stable, so they're less likely to rupture. Other meds can help prevent clots, get blood pressure under control, and manage blood sugar, basically tackling all of the major accomplices to the crime head on. And really, this all leads us to the most powerful conclusion from all the clinical data. The main takeaway is this: the heist is a preventable crime. By managing our risk factors and making smart lifestyle choices early on, we can dramatically, and I mean dramatically, shift the odds in our favor and stop this crime before it ever reaches that dangerous climax. So let's go all the way back to our original question. Is cholesterol the villain? Well, as you can see, it's a bit more complicated than that. LDL cholesterol is definitely a key player, but it needs that whole crew of accomplices and a weakened system to really pull off its crime. The story that's unfolding in your arteries right now is one that you have a tremendous amount of power to write. The only question left is, what will that story be?